Assalamu alaikum wa rahmatullahi wa barakatuh, dear brothers, sisters, and friends. Welcome to another episode and interview addressing the coronavirus pandemic. Today, we are really pleased and honored to have with us a really special guest, Dr Billal Patel, who is a consultant cardiologist at Blackpool Hospital. Before we begin the interview, I'd like to share an update, a global update on the number of coronavirus cases. Unfortunately, those who have deceased as well from the virus, but some good news on those who have been reported to have recovered. Currently, as it stands, we have coronavirus cases in approximately the number of 678,905, deceased from the virus at 31,771, and those who are reported to have recovered at 146,319. Today is March the 29th, Sunday. Naturally, these numbers will change drastically upon release of this show. But with no further delay, I would like to introduce brother and Dr. Billal Patel. Assalamu alaikum wa rahmatullahi wa barakatuh. How are you, Dr. Patel?
Wa alaikum assalam wa rahmatullahi wa barakatuh. Alhamdulillah, I'm well. And thanks for inviting me on your podcast.
Oh, it's an absolute pleasure. Billal, I wanted to first ask you really, how are you? How is your health? How are your family and your loved ones and friends?
Alhamdulillah, so I'm fine now. I was in self-isolation for nearly 2 weeks. My symptoms were quite mild. I started off with a very mild tickling cough. Actually felt quite well for about 5 days and then started to feel achy, headache, and the cough carried on. But out of all the 13, 14 days, there was only one day I would have actually thought, maybe I won't go into work. But I was in isolation during that time. Alhamdulillah, I feel well now. My youngest, my 6-year-old, developed symptoms a few days ago of high fever and cough. Alhamdulillah, she's getting better as well. And the rest of the family are good. My older brother, younger brother and sister have all had symptoms, but they all seem to be recovering now as well.
Alhamdulillah, really pleased to hear that. And that's quite consistent with how Public Health England and professionals have and experts have described how most will experience symptoms of the coronavirus, that most people would recover and it would be mild to moderate symptoms. From your experience, have you found that to be the case beyond your own experience?
Well, I think, I've got quite a few friends and colleagues that are also self-isolating at the moment, and that appears to be the case, that most people will be all right. But the worrying thing about this is that, with very mild symptoms, you're contagious and you're spreading it. And that's a far bigger concern then, because, if you've got vulnerable people around you, even if you haven't, but you're spreading it to others, the risk is, a population level, there's a huge risk there of you being spreaders and increasing the number of cases nationally and globally.
There was a video that you made whilst you were in self-isolation. So this was, correct me if I'm wrong, a couple of weeks ago?
Yeah.
And this video went viral, and no pun intended, but it really did go viral, especially in the Muslim community. And I just wanted to ask you, what made you want to make this video? It was really, really useful. And it was one of the videos that I heard, and many others who I'm in communication with, they found it very, very powerful. Talk to me a little bit about what drove you to release this video.
Yeah, so, I think the doctors and the health professionals have really been very concerned about the impact that this virus is going to have on the UK. So, we've been planning for the fallout from this for a while. And then when I developed symptoms, went into isolation, for the first 2 days, the hours were going really slowly. Then spoke to a couple of friends and they said, look, you're telling us information which people don't know out there. What you're telling us actually sounds quite scary. And really, because people know you in the community and you're a medical professional, why don't you try and put something out there? And I thought, I'm not really one to make a video or, to send it out. But I thought, well, actually,
Right.
This might be a good idea to get the message out. And really, it was aimed at our community to make them understand how severe this is going to be. So it was aimed at my local community. I made the video, and then from there, it spread far and wide. And then people said, can you do one in Urdu? Can you do another one? Can you do it in different languages? And then from there, I put a second video out, regarding social distancing. And then from our one of the guys who we train with in the Brazilian Jiu-Jitsu club, he put it on Instagram and Facebook. And then, so actually the message, although it was originally aimed at my own community, it actually ended up going to several different communities. And I didn't really realize how useful that would be. I've been a doctor for 21, 22 years now. And in the work I do, we deal with people with heart attacks. If you have a heart attack, there's a blockage, we open the blockage up. So it's like, you're a plumber for the heart. And in that, you do save some lives. But then on reflection, you think that if more people got this message in a few days, that will have far more beneficial impact if you just look at how this virus is spreading and how many people it's affecting as we're seeing now.
Oh, absolutely. And that's a really good segue into one of the things I wanted to ask you today, which is you mentioned that you made a second, third, and more videos after the first one. And people in the community asked you to do it in different languages so that it was more accessible to other people in the community, right?
Yeah.
One of the questions I wanted to ask was, what is it true? Because there is some news coming out from different Muslim organizations and different sources that 20 to 25% of the deceased in the UK from the coronavirus seem to be Muslims. Is that true?
So it's hard to verify the figures. We do know from early on that from the first first 10, 4 of them were Muslim. And then we got early reports that, maybe 20, 25% of the fatalities are Muslim. But there's no way of actually verifying this because on the death certificates and the data that's gathered, we won't capture the religion of an individual there. But we are finding, I've just got news today, that we've got 3 Muslim doctors that have passed away. 2 of these are Sudanese. And there's another doctor that was a GP and have died from this. And these are from the UK. And one of these, a friend of mine, knew him personally. So I think it does seem to be affecting the Muslim community more. Why that is, there might be multiple reasons. We generally live in extended families. In our culture, you've got a lot more physical contact, and it's really hard to keep the kids away from the vulnerable. So that might be a reason there.
What do you think some of the barriers might be for South Asian communities, other ethnic minority communities, in understanding the severity of this virus? Yeah, what do you think some of those challenges are?
First of all, I think that the barriers have actually been widespread in all communities, really. Specific to the Asian or Southeast Asian community has been one. It's the mindset. So we've got a mindset that a fatalism or whatever's going to happen is going to happen. It's the will of Allah subhanahu wa ta'ala, and let it be is one factor. The other factor is that it's something that you can't see. So because you can't see the virus and on the street, and this applies to the general public as well, life seems to be going on as pretty normal. And you just get the impression that some people are sort of causing, panic or fear. And then the other factor really is a language problem as well. So I think, they're the factors that really affect the message getting through. But I think, we've had difficulties in the message getting through in all communities.
Yeah, and we're all trying to do everything we can in our respective communities in terms of trying to break those barriers and get information and awareness on this subject of the coronavirus pandemic and try to make it as accessible as we can. And this interview with yourself is one of them. And perhaps there's people in our community, going back to the point you made about fatalism, who believe, what will happen, it's God's will. What message would you give to people in our community and other communities who are having that approach? What message would you give to perhaps...
So what I've said there is that, if you just look at from an Islamic perspective, we believe everything comes from Allah subhanahu wa ta'ala. All power is in his hands. So, for example, if a fire is burning, you put your hand in the fire. In Aqidah, you would say that it's not the fire's burning, Allah subhanahu wa ta'ala is causing the burning. So I give, and I've had this direct discussion I'm having with you with multiple people from committees and certain scholars as well, saying the fire's burning. Are you going to put your hand in there? And the answer is no. In the same way, we know that disease comes from Allah subhanahu wa ta'ala, the cure comes from Allah subhanahu wa ta'ala, but He's created the means and the asbab. So, let's use some, let's use that and tie your camel, and don't expect, for you to be safe just having your faith in Allah subhanahu wa ta'ala. And the other sort of message I've given, so some people have said, well, they don't mind if they catch it and they die, not a problem. I said, that's fine. For you, that is fine. However, if you do get coronavirus and you die, it's a very lonely death, because your family, they'll be in isolation. Your family won't even be able to come and bury you as well. The whole ghusl, janaza is very, very problematic. And on top of that, if you know and understand that the virus can be transmitted and may end up in disease, and you end up spreading it to people down the line, you could be directly responsible for the death of individuals. So although you might be happy if the virus gets you and say, that's fine, it's the will of Allah subhanahu wa ta'ala, you will, however, be held responsible for the fact that you have been a spreader. And this is the message which I've sort of tried to get through. And in also getting that message through, I've taken some flack as well, because I've had to be quite harsh and quite straight to the point that, by people not taking the advice seriously will result in deaths occurring. And I've used some of the figures. So the virus, one person who has the virus will on average spread it to 2.6 people. And over the space of every 5 days, by the time you get to 30 days, that's 406 people will be affected. Uncontrolled, without social distance measures, in another 30 days, nearly 50,000 people will be affected. So even if you take a very conservative estimate of a death rate of around 1%, that's still responsible for the deaths of around 500 people in 2 months' time. And if you understand the virus can be transmitted and it can affect people, most will be fine, but will cause death, then everybody has got a responsibility to act, not just for the safety of themselves and the family, but to the wider community and for the whole population.
Incredible. And that's a really powerful message. And I hope that it does have an impact on whichever community is receiving that message for the good. Bilal, if you could, you mentioned it briefly in the video that was circulated a couple of weeks ago when you were in self-isolation. But if you could, for the viewers and those who are going to access this interview, explain in a simple and accessible way how the virus actually works in terms of once you are infected.
Sure. Okay. So the virus is, it's amazing, the virus is like 1,000th the size of the width of a human hair. So it's tiny, absolutely tiny. And the virus itself is very simple. It's got 3 parts. It's got a capsule. On the surface, there's these spikes, and it looks like crowns. That's why it's called coronavirus, corona for crowns. And in the middle is you've got the genetic material. So on its own, the virus can't do anything. It's helpless. It can't reproduce. However, once it infects somebody, then it can reproduce. So if I've got the virus and I either cough or I sneeze, then the virus can be released by droplets. And if you then inhale, or that goes through into your mouth or into your nose or on your eyes, you can then become infected. If I cough on my hand and then shake your hand or touch a surface, the virus can stay viable on a surface as well. So then you can touch the surface, and if you touch your face, you can contract the virus. Once the virus goes into your mouth or into the lungs, it will then attach onto little receptors. So the virus has these spikes. The spikes act like keys. It attaches onto the cell, and the key opens the door into the cell. The virus will then go into the cell, and then it will break up into its parts. The genetic material will then hijack the machinery of the cell, and it will then become a factory to mass produce all the spare parts of the virus. And then these spare parts form further viruses, and then they are disseminated through the body, and in that process it will kill the cell. As the virus then affects mainly the lungs and the breathing apparatus, the lungs are these like tiny balloons, and there's millions of them called alveoli. And normally as you breathe in, they stretch open, and as you breathe out, they close. And you get an inflammatory reaction, and these little alveoli, they get full of fluid, and then it makes it very difficult to breathe. So that causes the pneumonia, and that causes the difficulty with the breathing. In our field that we work, in the cardiology field, we know a lot of people get cardiac complications. So you develop inflammation of the muscle of the heart, you get conditions mimicking heart attacks, but it's just because the muscle of the heart has also become affected with inflammation.
It's really quite fascinating, but for many people who are hearing how the virus actually functions is really quite worrying. But it gives an image and an explanation behind this invisible killer. And it brings me to another point that hopefully you can expand on, and it's this idea of viral loading in terms of the coronavirus and how it functions. There's been some conversations amongst experts as well as people in the community around viral loading. How does that work, and what impact does that have in terms of keeping you safe or the severity of your symptoms?
So most of the time, it's the virus is spread by droplets. That's the most common form. There's another way it can be spread, which is called aerosol. So in aerosol, it's the very fine particles. So in the hospitals, certain procedures that you do, for example, if you're on oxygen mixed with water, humidified oxygen, or if you're in the intensive care unit, or if you're doing resuscitation on somebody, all of these sort of procedures will generate aerosol. When you generate aerosol, the person who might receive the virus can get a large viral load. That's one of the theories why they think that why do the frontline medical staff seem to be affected more, why some of the doctors that are on ventilators or anaesthetists or the ENT surgeons that mainly deal with ear, nose and throat surgery. And the theory is that if you get a very large viral load, you actually get quite a severe reaction. The reality is we don't really know because everything is quite new. This has only been around for a few weeks, but we're learning day by day.
Yeah. It goes without saying, and we're getting the headlines and the updates every single day, that this virus has had a massive strain on the National Health Service. As a physiotherapist, when I've had rotations in respiratory wards, and I've treated patients in a physiotherapeutic way for community and hospital-acquired pneumonia, in the winter, you get an idea of how busy things can get. I have no idea, and I can only imagine what it must be like in hospitals now, treating patients with the virus. If you can give us an idea and shed some light on your experience returning to work and those of your peers and colleagues.
Sure. So I only actually returned to work on Friday, and on Friday when I returned to work, it was just to get my my mask fitting. I've got my mask here. That's the you just need to check that you've got a clear seal on the mask. And first proper day back was yesterday. At the moment, things are still relatively quiet in the north. London's been hit quite badly, and we're sort of lagging around anything sort of 5 to 10 days behind London. The mood has been quite somber, and at the moment, it's like the calm before the storm. So we've stopped doing all activity apart from the emergency or the very high risk cases. Everything else has been suspended. On Friday, we had 16 confirmed cases in our hospital, and the cardiac intensive care unit, which is normally reserved for patients after cardiac surgery, is now our coronavirus part of the coronavirus unit. And we're expecting, as in other places we've seen, the cases are doubling every sort of 3 days. So we expect our peak to occur in around 3 to 4 weeks' time. So at the moment, things are relatively quiet, but we're just preparing for the huge influx of cases. And I hope that I'm wrong. I hope, I'm a raving lunatic and people think I have just been scaremongering. Because if that's the outcome, then brilliant. But, looking at the data that's coming from other countries, particularly looking at the Italian experience and the fact that the measures we've taken have been following them step by step, it would take a miracle for us not to go down that same path.
And that's a really interesting point, which brings me to something else that I'd like us to explore, which is there's people in our communities, and when I say our community, I don't mean specifically the community that we might live in terms of those that we share cultures with, but communities across the country that are actually definitely in a mind frame and an attitude that this virus isn't that bad. And perhaps there is some fear mongering, and perhaps there are some people that are just hyper vigilant and hyper aroused, actually. Someone like yourself who is in the front line, who has recovered from the virus, including your family, doesn't it make sense that people who are having greater and closer contact with the virus and those affected would probably have a better idea of the severity of this virus? What message would you give to those who are probably a little bit more relaxed?
So I think it's quite complex because because the data suggests that most people that will get it will be all right. And there's an argument, and people have made this argument. Well, just actually, the death rate is far lower than we're being told because not everyone's being tested, and I also accept that as well. But the reason why on the front line, why we've really been worried about what's happening is we know the strain it's going to have on the health system. So the way I explain it to somebody like that who says, well, if I get it, I'll be all right, would be that's fine. If you get it, you'll be all right. But say 3-4 weeks down the line, you're involved in an accident. You're riding your bike and you crash the bike and you have some internal injury and you need to be rushed into hospital. Now, normally you would survive because we've got the best treatment, all the beds and the facilities. But if this happens when we're in the middle of a pandemic and intensive cares are full, the doctors are overworked and you haven't got the equipment, somebody like you who's normally fit and well and healthy, who can easily be dealt with the facilities that we have, there's a good chance that you might die because we can't provide you the basic need you have to save your life because of the strain on the health system. So that's, one message I give to people is of a greater responsibility of not allowing the health system to collapse or crumble, because the knock-on effect of that is huge. At the moment, people are just concentrating on, coronavirus deaths, but I was on call for heart attacks, in the last 24 hours. Normally, it's fairly busy. Normally, in 24 hours, you'd be called in around 3 or 4 times, sometimes even more. And generally, countrywide, it's been pretty quiet. Part of the reason is everybody's scared to go to hospital. And if somebody does have chest pain, for example, then they might just ride it out saying, well, I'm not going to bother calling an ambulance. They're really busy and we're scared at the moment as well. So there's a big knock-on effect of all other things associated with this as well. And I always go back to the point of people who aren't taking it seriously, is that I say, that you will be responsible for causing death down the line. And especially when you know and understand regarding how the virus spreads, you might be absolutely fine, but you might kill one of your elderly relatives. You might kill somebody within your community. And often the impact of this can be massive. We know that a single person has caused a huge amount of spread in many different countries, and that's been well documented in more than one country.
Bilal, I wanted to ask you another really important question, which is on the subject of social distancing and the barriers to Muslims and other Southeast Asian communities and cultures who probably aren't able to access the government guidelines around social distancing in the same way we do because of a language barrier. What responsibility do we have, do the English-speaking Brits in the families have in order to increase the vigilance in our households? Because I think a lot of it is possibly down to just not being able to understand the severity of what's going on because they can't access the language. Like, for example, I was having this conversation with a colleague and the word pandemic, I mean, what's the equivalent to the word pandemic? I mean, we hear the word pandemic, we have an idea of what it means because of the context in which it's used, even more so now. What's its equivalent in Bengali, Urdu, in Punjabi, or in Arabic? So
yeah, so I think you're right. Everyone has a responsibility, but and once we understand the severity of the situation, you've got to get it through to the older community. And I found just within within my own community, I had to explain to my own mother how difficult it's going to be and how important the situation is. And I've had other people contacting me saying, look, we've got your video, we understand, but can you make it in the different languages so they'll understand? So I've tried to get that message out. But for the people that do understand, they've got to explain the message and the reason why the social distancing is important. It's not just about self. It is about a wider responsibility. And also for our elders, A lot of them have got heart trouble, they've got diabetes, they've got high blood pressure. They're the at-risk population. So it's even more important because they will be more affected, that we protect them. But there the responsibility comes from individuals within the family. And at a wider community level, this is where, whatever community organizations that we've got, they also help in getting the message out. And, alhamdulillah, I think, around in the Northwest, that's been actually quite successful because after getting the video out, people said, can you get the different languages out? Then I put some thing together in terms of giving advice. And I got that out, and quite a few of the mosques then circulated that around their own communities, to get people to get a better understanding. And I generally have to say, although we started from a position where it seemed like people weren't getting the message, in the space of a few days, and certainly the last couple of weeks, the message seems to be getting through now. That a lot of the mosques decided to close well before Boris Johnson announced that places of worship should close. And a lot of and a handful of places put in mitigation beforehand. But generally, I think although we were slow to get the message, once we've got the message, we have started to act pretty quickly.
Alhamdulillah. And I've noticed that as well. I mean, by and large, the majority in our respective communities are understanding, slowly but surely, what they can do to try to have a positive impact and try to influence it in the right direction. There has been another reaction, if you like, in our communities in terms of panic buying, going into stores and trying to getting your hands on wherever you can. Some people have even gone and bought refrigerators and extra freezers to cater for their stockpiling. I wanted to ask you, Bilal, how are you doing for food?
Alhamdulillah, very well. There's no problem at all with food. And I just think that panic buying is just what I find difficult to understand is when, on the one hand, you've got faith, and on the one hand, the same people are saying, well, I'm not bothered what's going to happen to me is going to happen, would then go out and panic buy. So the two things don't go hand in hand. And I think that's where you do need your faith, that Allah subhanahu wa ta'ala will provide for you. I found it very, it's quite sad to see, actually, very sad to see. But I'll give the benefit of the doubt. I think maybe the people are stockpiling to give to food banks and to give to their neighbours and to their communities, because we've also seen a lot of good work happen. Certainly around Preston, the local community has really going out of its way. They're helping the vulnerable in the communities. We had one food bank set up, which has been set up for 18 months. It's been really busy. But then another 3 food banks set up by the local community is going and supporting people that are in need, supporting the NHS. And people are going well out of the way now to pull together with some community spirit. So I think at the beginning, people might have been scared. But I think now, they're pulling together and doing what they can for the wider community.
Alhamdulillah, that's really good. With regards to supporting people who are less fortunate than we are in terms of material possession and finances, people in our community, especially the older generation, they often associate difficulties and struggles with what they've witnessed growing up, whether that's poverty, or what we have grown up witnessing around the world. Devastation, natural disasters, wars, hundreds of thousands of deaths, as well as famines and other diseases. And we often associate that with true hardship, what true hardship and trials and tribulations look like. Would you say, and is it fair to say that we are experiencing a version of that ourselves here in the UK?
I think to put it in context, still, we are experiencing, I find it hard to compare this to what people around the world are going through. If you look at it, for us that are born and brought up in this country, through our lives generally, you've had a very, very comfortable life. And even now, what's the worst thing is, you can't go out. We've got roofs over our heads, you've got food, you've got safety, and we've got these things. So it's not like, you've got real hardship. The disease, could spread, people will be affected, and that will be difficult and tough. But it's not like, you haven't got the safety to go out of your house. Your family is going to get killed, and you're worried about bombs falling on your head. So looking at it from that perspective, I think what we're going through is relative, and it's very mild. And actually, you think you always try and find some goodness through whatever difficulty there is. And I think, there is some goodness for this, because, for the next generation, for the youngsters who pretty much have had everything on a plate, it's actually going to make them realize to be grateful for what it is that they've got, and, to get used to really a more basic, simple lifestyle. And, you could be quite content and happy with that.
Yeah, definitely. I agree 100%, and thank you for that message. I think social distancing and self-isolation, and what we're doing now in terms of measures to keep ourselves and others safe, is a huge opportunity for us to observe gratitude to Allah Azza wa Jal, and gratitude for everything we have in our lives, especially our family is a huge one, for those that we're living with and for those that we can't have access to right now, in terms of our efforts to keep them safe. I wanted to ask you, Bilal, where do you see things going, and how do you see things progressing, not only in your experience and the strain on the NHS and how things are going to be at work moving forward, but how do you think things are going to be generally with the impact of this virus in the next, say, 1 to 3 months?
Well, I think it's certainly going to get a lot worse before it gets better. I think the next 2 months are going to be crucial, because again, if you're following the Italian model, the effects of sort of social distancing and lockdown sort of comes in around 3 weeks after the measures go in. So I think we are going to hit a peak. During that peak period, I hope that all the hospitals are able to cope with what comes through the doors. And then I think we're going to be in a situation of uncertainty for a significant period of time. I think things are not going to go back to normal for several months. It may well be that it will be an on-off situation, where the sort of lockdown is relaxed, then it's put on again, relaxed, then put on again. But I think we're going to be in uncertainty for a period of about a year. The worst part being really the next 3 months.
And as a closing message to our viewers, those who will be listening to today's interview, what message would you give to the Muslim community, any community, who perhaps aren't taking it as seriously as others, but also those who are really, really worried to the point where it's impacting them in terms of their well-being, their mental health, and other things? What would be your message to them?
So I'll deal with the second one first. There can be certainly a negative impact on mental health, and as we see at the moment, especially if you look at the messages that are going around on WhatsApp, a lot of it can be negative, and if that's all you're getting, that's going to just, that's just the only thing that's going to grow inside of you. So what I do say is, of the information that comes through, don't delve on it too much, don't forward it on, verify your facts. There's still a lot to be grateful for, the things that I mentioned before. Things could be, significantly worse. If you are worried about getting it, on the whole, most people that get it are going to be fine. On the whole, it will be generally a minor illness, and then you will get better. The main responsibility you have is to avoid getting it and to avoid spreading it. To those that still think, it's nothing to be taken seriously, you see some of the measures that have come in by the government, and the fact that they've taken the Excel Centre in London, the fact that they've taken other large exhibition centres and making makeshift hospitals. That tells you that this is not something to be taken lightly. I've had people saying, "Oh well, it's all nonsense. It's all fear mongering," and the reason for that is because we want to introduce all these measures, so it's not really real. There's nothing really there. We're telling you from what we're seeing up and down the country, and what we're seeing, the increase coming through the front doors. This is very, very real. And if you don't take it seriously, in 2 or 3 weeks' time, you're going to be crying, thinking, "Why didn't I listen? Why didn't I take it seriously?" Especially then, if you realise that you have been responsible for spreading it around. You've been responsible for the fact that there's hardly any beds available. And ultimately, you will have been responsible for causing death down the line because of the nature of the illness that it is, the small percentage that do become seriously unwell and die, you know, is very worrying. I mean, just today, I got the news of these, 3 Muslim doctors that have passed away. And think about the guys that are going out. All you're being asked to do is to stay at home. Think of the people, the doctors, the nurses, the people that are keeping the country running, the people that are running the shops, all these, people that are doing all of these roles. They're doing this to look after the health, to make sure food goes on the table, to make sure that the country generally runs. All you're being asked to do is to stay at home. Stay at home. Don't go out. Just follow the guidance. And I don't think it's a lot to ask, because if you were to not do that, the price that others will pay is a very big price. And I just think it's extremely selfish for people to have that mindset that, well, I'm all right, I'm going to be all right, and not bothered about anyone else.
Brother Billal, it's been a huge honor, and we really appreciated you being with us today. A lot of information that was shared in our conversation that I'm certain will be of huge benefit to those who listen, especially our communities that we share cultures with, who probably aren't accessing the headlines, the information and the precautions and the warnings as easily as others. I pray Allah Azza wa Jal protects us from disease and from ill health, whether that is physical or mental. I pray Allah Azza wa Jal makes us amongst those who are able to take advice and able to do what we can do to keep ourselves and others safe. And I pray that our families and our loved ones and our friends and our communities are vigilant during times of danger and are able to take the necessary steps to bring good to the places we live in. My message to you, Billal, is we're really, really grateful for yourself and other healthcare professionals that are trying their hardest and are exposing themselves to danger every day. And we pray Allah continues to give you the tawfiq to do good and protects you and your families.
Ameen. Yeah. Thank you. So I've just missed out on my ban, haven't I? Because I'm.
Yes, you have. But I'm sure next time when circumstances change, we'll be able to offer you something like that or better.
Yeah. Jazakallah.
It was good.
Thank you for having me on.
It was good having you on, and inshallah we speak to you soon. Take care. All the best. Assalamu alaikum wa rahmatullah.
Wa alaikum salam.
Brothers, sisters, friends, those who have watched today's interview, my message to you, alongside the message from the good doctor, Dr Patel, is stay at home. Do everything you can do to keep yourself safe, to keep your family safe, the people that you love, the people that are dear and close to you. Very simple. Stay at home. Follow the government guidance around self-isolation and social distancing. Don't deny yourself the ability to go out and stretch your legs and have exercise, but do it within the right guidance. So keeping a safe distance of 2 meters at least from people that are not in your household, and wash your hands, stay clean, and keep up to date with the news so that you understand how serious the matter is, but at the same time, try to find a balance and not worry yourself to the point where you are unable to enjoy things. This is a huge test for us all. Everyone is affected, some more than others. And I pray Allah subhanahu wa ta'ala brings us through this difficulty and we are able to overcome it, and we are strengthened and we become closer as a community. It's been an absolute pleasure to be able to bring some information to you that I hope is of some benefit, and I'm sure I'll be seeing you again. Your brother Aki Hussain. Assalamu alaikum wa rahmatullahi wa barakatuh.